I would like to thank all of you for coming today, and we're very excited because we've hit some major milestones, and we are passing the reins to an amazing group of leaders in our community. And so today we are celebrating that milestone, and so we're going to talk a little bit about our journey for the last 15 years that we have been together working on access to care issues in Buffalo County. So community partners, the first thing I can remember, and I think there's probably a few here in the room, about 2000, the year 2000, the turn of the century, we sat down and we discussed as a community about what do we need to do to help impact healthcare issues and access to care issues in Kearney. And one of the thoughts was to mobilize into a group called the Community Health Access Team, and that team fondly became named CHAT for short. And we've been calling the chat group for many, many, many years. And there's members of the CHAT team who are here. So do you want to just kind of raise your hand and give a little wave and let people know that you have been working diligently on this project for many years. So thank you for your dedication and your commitment. We also are going to pass the reins today to the financial reins to the HelpCare Clinic Board of Directors, so that's a pretty exciting milestone. And we also want to recognize the funders and the key partners who have helped us get where we are today. So I want to talk a little bit about the amazing innovators we have in the room, as well as in this community, and also the amazing philanthropists that have stepped up to the plate. The amazing leaders that are changing our healthcare environment that we have seen in the past. There are people here who are driven by their faith and a passion to serve, and there's champions for the voice of the uninsured in our community. So to start off, I would like to just make sure and point out that Buffalo County Community Partners has been a facilitator of this process. You are the partners in this room who have really made this work happen, so thank you to every one of the organizations and individuals who are here. We've been working on elevating the access to care issue and working to build a model in Buffalo County that is innovative and creative and fits the needs of our community, and what a wonderful gift to be able to do that within the Kearney community and to work with all of you to do that. Our goal, we set in the year 2000, was to have 100% access and zero health disparities. And we thought, wow, what a novel, aggressive goal for our community to invite others to participate in. And I would say just 2 or 3 months ago, we sat down and we said we're very, very close to having that goal attained in the Kearney community. So first off, I want to thank the members of Community Action Partnership in Nebraska. They have been with us from the very beginning, and this was not a new topic for them. They have been working on access to care issues in our community for many, many generations. So thank you to Julie Weir and Meredith Collins at Community Action Partnership for their amazing support of our work from the very beginning. They were the group who really brought to the table the first model of a free clinic within the community with the Clinic of Good Health in Gibbon. We have learned much from their leadership and their commitment and what works in the community, and really built the model that we are hoping to release today to all of you. So thank you. I also want to recognize Ann Traverdick and Beth Baxter of Region 3. They've helped keep behavioral health a focus of the work that we're doing. Access to care and behavioral health are tied very, very tightly in the conversations that we've had at the table from the very beginning. We also need to recognize our physician team. We have Dave Glover with Family Practice, Peggy Dovish at Kearney Clinic, and also Tom McLeod at Platte Valley Medical Group. These clinics were instrumental in helping us to understand what we need to do to serve patients in our community, to understand the perspective from physicians in our community, and help to build a model that fits the need and how they see the need in the community. So thanks goes to each of those clinics, as well as the models that began to evolve over these 15 years really took into account a community health worker model. And each of those clinics are working diligently to embrace community health workers in their own model and have become a state and a national leader on community health work. So our kudos to those partners of ours. Also, I want to reach out to Denise Weibel-Reisek, who's actually our chair of the chat team, and also Steph Burge, who was one of our first nurse practitioners with the Clinic of Good Health. They both are at UNMC, and we've learned greatly from them. Every time we look at an opportunity where education and nursing can be brought to the table. They are always there to bring the resources and to help us understand how we can do it better. I also want to thank Lisa Reese Parish and the United Way. With their support, they've helped us connect with all the service agencies within the community, and we thank them for that. Crystal Winfield, I know she was here just a few minutes ago. I'm not sure where she went to. They're actually housed in the other half of this building. UniNet, the Kearney chapter, we'd like to extend a thank you to them for the amazing work that they have done. They stepped up to embrace a model in which over $500,000 was awarded to our community. The model, they stepped up as the employer of community health workers and also helped us to involve over 250 clients in our community who are diabetic and are looking for access to care. And these 250 individuals have taught us a wealth of knowledge in our community. We listened to what their needs were. We helped build a system or a network around them to support them. And based on what they have shared in their stories is really what is becoming today the HelpCare Clinic. So thank you to Crystal Winfield and the staff at Kearney UniNet, as well as Dr. Shaffer. I should mention their medical director. Thank you, Dr. Shaffer. I also want to extend a thank you to Good Samaritan Hospital, the team of Mike Schneiders and Carol Wall, as well as Dr. Edwards and their board of directors has been amazing. They have been very humble supporters of our efforts, always helping to share resources as we need resources, willing to help us find resources as we're looking for them, and we'd like to extend our thank you to them. I calculated since we started over 15 years ago, there was probably, there's over $1 million in resources that have come to the table from grants through the network of Good Samaritan Hospital. And Denise, we just mentioned you, but thank you for all your work towards the clinic. Just want to make sure you heard that. So without further ado, let me make sure, did I have everybody here that I mentioned? I would feel terribly if I forgot anyone. So again, what we're working on here today is to let you know that these partners had an amazing role in building what will now become known as the HelpCare Clinic. Buffalo County Community Partners was key in being the facilitator to bring people together, to have conversations, to figure out what model worked best for our community. Our job is done. We're so excited to be able to take a project for the last 15 years and be able to hand it off to an amazing leadership group at the HelpCare Clinic. So to start with, I want to invite Dr. Ken Shaffer to come forward and tell us a little bit of his perspective of the physician community and their involvement in the project.
Well, I would tell you that here stands a old retired dumb pediatrician who for a long time has known that our medical community lacked one thing, and that is we lack access to a free clinic for a number of patients. Our doctors and hospital, Good Samaritan Hospital, has been wonderful seeing patients that don't have insurance and taking care of them. So I would have to tell everyone in here our doctors have done a yeoman job. However, there is a big segment of the population that we don't reach. And I think each doctor and healthcare worker in our community realized that there was a population that we didn't reach. And you know, part of our journey has been that we've had an evaluation. I can't pronounce Mark's last name. Rukavina. We had a grant to bring in Mark to really do a community assessment of the needs. And we actually know in Buffalo County there are somewhere between 3,000 and 5,000 patients that really are not insured, and this is a good access point of what we're developing. So it's been a long time that we've needed it. I got involved in it a couple of years ago as Denise encouraged me to join the board, and it became pretty obvious to me that this was a need that we needed to work on. A dumb pediatrician at that point in time felt that this was an easy task. get a couple of my friends together, and we could open a clinic in short order, a couple months. And that's how naive physicians are. Pretty naive. And as I've watched what's happened, it's been an amazing process. You really did facilitate the community. And that's really something. Because it became very obvious to me as we've gone on that Ken Shaffer could certainly open a free clinic, but that's not very sustainable. We have to have a community, a network of people to sustain this. And that's what we now have, I believe, is through Buffalo County Partners, Community Partners, we actually have a group of people that have come together, that have looked at our alternatives, that have joined together and put together, I think, a great plan. We've had some donors that we really appreciate that facilitated us being able to put the infrastructure together. The infrastructure is getting very close for us to be opening, and so I'm very thankful of all that. I think the care that we delivered before this, when people went to the emergency room and used it, we delivered episodic care. And medicine is very good at episodic care. You come in today, we take care of your problem, send you out, and we don't do a very good job of continuity of care. And that's what is really changing in medicine. Medicine really is trying to now get to a primary care base that really can deliver continuity of care and follow these patients for years. And what happens with people that have episodic care is they come in today, they get something treated, they run out of their medicine, they don't go back, or they can't afford their medicine, they don't go back, and they just get themselves in more problems. So it's a kind of a rolling ball. So hopefully this gets us out for that population. Hopefully we can reach out to them, and some of that episodic care will turn into a much better system for them, a much better care system for them. So I guess I'd like to thank everybody. I think it's been a journey, and I do think we have a model that is very sustainable in our community. I think we've had a calling. I think we felt very, very early on, Denise and I felt that we really had a calling to our faith community, looking to them for our support, as well as our other community leaders, and I think we now are beginning to develop that. So I can't be more happy than where we are today.
Thank you, Dr. Shaffer. And speaking about the faith community, they are the glue that is holding this project together. It's amazing. As the first visit that Dr. Shaffer and I had with Carnegie Evangelical Free Church and Holy Cross Lutheran Church to begin those conversations about how the faith community would like to be involved in this project really took off at warp speed, faster than what we even expected the community to take hold. So we've invited Dustin Lappe, the associate professor, associate pastor at Holy Cross Lutheran Church, to tell us more about the faith journey in this project. Dustin?
Thank you. Well, good afternoon. I'm honored to be able to be here today and to be able to serve on behalf of the board of the HelpCare Clinic, especially when you consider I'm still fairly new to the Carnegie community. 2 years ago, my family relocated here from Denver, Colorado. And when I was talking with people in the community, I heard over and over again those who shared that there is among Kearney this willingness in people to partner together and to help make a difference. And I've truly seen that in the last 2 years. And the HelpCare Clinic is just, it's an amazing example of that. As you've already heard here today, there are those who have identified a need and want to do something about that. And the need is real. I mean, I've met with the single mom who is unable to afford shots for her kids. I've met with the couple who's trying to get back on their feet and having to choose whether putting a roof over their head and food on the table or being able to afford the care that they need for their health issues. And those are just beginning to scratch the surface. There are so many stories out there. I'm excited that the faith community is welcome to be a part of this. As Dr. Shaffer said, I really believe the faith communities can help within the sustainability of the clinic, and that we have a lot to offer, like people who care, who have a heart for those in need, for those who understand what Jesus meant when he said, "What you do to the least of these, you're doing to me, for I was sick and you cared for me." In our congregation, I know that there are many who are gifted in the medical field and who have a heart to serve. And even those not within the medical field, but also want to be a part of this because they see the impact that it can have for this community. And so, again, I'm humbled, I'm excited to be a part of this because I truly believe this clinic will be a blessing to the community of Connie. So, thank you.
Well, there are some additional special guests that we also want to recognize today. We were just discussing, Dr. Shaffer went and met with Bill Oldfather and talked to the Ron and Carol Cope Foundation to help this initiative get off and started, to allow us the opportunity to hire Linda Muhlbach as our planning team leader to get a nonprofit 501c3 organization put together that would help build a clinic in a model that we felt would be the best model for our community. And we thank the Ron and Carol Cope Foundation for their gifts. They gave $30,000 at the beginning of last spring, so almost a year ago today, to help us get kick-started and get this show on the road. So thank you, Bill, and all of your mentors who help support the good works in the community. We also invited Judy Sickler from the Kearney Area Community Foundation. They also stepped to the plate this year and presented a grant to the HelpCare Clinic to help support clinic operations, as well as the UNK Helping with Humanity grant that was presented to the HelpCare Clinic. Community Partners has been the fiscal agent for this work for several years. We have been adding a running total of the donations that have been coming in, and so with these three funders with us today, we've received half of the funding that we're going to present to the HelpCare Clinic Board today, so thank you, we appreciate that. The other half, you might ask, where does that come from? It has come from people in this room. It is people who are getting out their checkbooks and donating as individuals. They are submitting funds through We Raise, a campaign that the HelpCare Clinic started this fall, as well as the Give Where You Live campaign with the Kearney Area Community Foundation. So we're honored that people are giving of their hearts and of their faith to help support this effort. So today, I would like to invite Nikki Gosman to come up, our chairman of the Buffalo County Community Partners Board, and I believe we have a check right over here behind me that totals the amount that Buffalo County Community Partners is awarding to the HelpCare Clinic Board of Directors. We're calling this our separation. It is a time to celebrate because as we've shared, it's been 15 wonderful years of working together, and this is our handoff to the amazing leaders of the HelpCare Clinic Board. They will now be their fiscal sponsors of their funds. They formed their own 501c3. They have opened their own bank account. They have their budget set. They have their financial policies in place. They have all the things that are very important to the sustainability of this clinic model. So we thank them for their due diligence this whole entire year in getting off and started. So if you would like to show everybody the amount of funds that we are presenting today, Madam Drum Roll. Today we're awarding $83,000. Congratulations for the funds that you have pulled together. And I would like to introduce Linda Muhlbach, the Executive Director of the HelpCare Clinic, and Julie Weir, the Chairman of the Board, to say any additional comments that you would like.
First of all, I just want to say thank you to all of you. Like Denise said, this started many years ago, and there have been a lot of people pouring a lot of work into this, more than I know about because I've only been with the organization for a couple years. And I like the term that Dr. Shaffer used, they incubated us. And I guess that's a pediatrician term, right? But as they've handed this off, we by no means have it all the answers, but we are working very diligently at this. Since last May, April, May, we've had over 40 volunteers within the community. Our board of directors, we followed a model called, that the Echo Clinics put together for us, where they put the timeline and the benchmarks in place and the structure for committees of different types that have worked towards accomplishing those timelines and benchmark items. So we are almost to our launch date. So we are getting there. We still have lots of work to do, but we like to thank all of you for the background, for the support that you've put into it. Buffalo County and Kearney is a great area to live, to raise your family. There's so many positive things, and it's easy to overlook the disparities. It's easy to overlook those things that still need work. But just like a family, you don't just take the good, you take the good and the bad. And when you own a community, you own it all. And so we just like to thank you for owning this with us and for helping this part of our community. So as Denise said, according to the Community Partners 2012 Community-Wide Assessment, 1 in 8 in our community is uninsured. So there definitely is a need. So we're just excited about this, and I would like to, along with Julie, have everyone who's on our board to just raise your hand. We have several people here. So thank you to all of these folks. They have done an amazing job. We get them in and we rush through about 100 things, and they walk out and it's done and they're ready for the next one. So we have a board meeting right after this, as a matter of fact. So we're going to lock the door and do a lot more work until we get it done. But I just want to thank all of them, and I'm going to turn it over to Julie.
Well, I am very humbled to be here. This was a dream. Our clinic that with Community Action Partnership of Nebraska closed a few years ago. The need did not go away, just the funding went away. So to be able to reopen and provide this care is amazing, and we're doing it now in this room, in these walls. This is going to be our clinic, and as you can see, it's a beautiful setting for us, and so we're just thrilled. Our launch date is April, and we will be offering primary care services to people that are uninsured. We have a large number of staff and volunteers, well, not a large number of staff. We have a few staff. We have a lot of volunteers. I should rephrase that. But we do have that can-do attitude here, and so this clinic definitely embodies the spirit of our community in Kearney, and we appreciate that very much. It is an emotional day. It's very exciting for us to take over the reins and the funding. We've looked forward to this now for quite a while. And we are ready for our independence. We've worked hard. We have a very strong board who is very diligent about their duties and has not shirked at anything. We've been really putting the hammer to it, and that's a good thing. So we're very excited about our adventure, and we're very grateful to our funders, the Carol Cope Foundation and Kearney Foundation, and all the other private donors that have helped us. It's just been amazing, and we just greatly appreciate it. In my job, I get calls every day for people that do not have any health care insurance. I took care of a woman at 1 o'clock this afternoon trying to figure out the system to get her what she needed. I had a child in my office on Monday. I mean, it all happens, and they're still out there. So Dr. Shaffer, you're really not retired. You're just relocated at this point, so just to warn you. So with that, I'd like to just tell you all thank you very, very much. We're very grateful and excited by this opportunity.